Most cases of gluteal tendinopathy is down to overuse. So you've done too much activity, more than what the tendon was ready for, or didn't give it enough recovery time, and it's become painful and injured. Now, the most commonly injured parts of the tendons are your gluteus medius or gluteus minimus tendons. Sometimes it's a bit of both, but it's usually just a small part of the tendon that's injured. And what happens is the tendon becomes super painful and it loses a little bit of its strength. Now, it's worth saying that just because your tendon is painful doesn't mean it's very weak. It's not quite a linear thing. Often the pain system can be dialed up or dialed down depending on other things you do. And one of the most common things that makes the pain feel worse than what it should be, that it's not even related nearly to the extent of the injury, is if you try to push through pain too much and just try to ignore it. Then the body usually responds by making things just much, much worse. So the key with rehab is that you get the combination of rest and exercise right and don't overstep the mark. It's absolutely normal to feel some discomfort when you do your exercises. And it's expected, to be honest. You can't expect to wait until you're fully pain-free before you start any exercises. It doesn't work that way. Often you don't get pain-free if you just try to rest it for too long. So usually the best combination that works is what we call relative rest plus then your rehab. And the relative rest bit is not necessarily complete rest. Sometimes it is, but often it's just identifying the things that push your pain too high and that takes too long to recover from and cutting them out or adapting your week that you don't do them in the same way that your tendon can recover. When it comes to the rehab exercises, they can be specific exercises, but it can also sometimes just be increasing your general activity. When we're injured, our bodies become really good at producing pain. And the pain intensity is not linked directly to the extent of the injury. Why is this? It's because it's a way that our subconscious is trying to warn us when you start doing something that it's worried about can make your injury worse. But because the system is effective, that alarm sounds way before you're actually doing something that's strong enough to cause any tissue damage. And you can dial that system up that it becomes too super vigilant through several things. The more that you believe something is dangerous for you or bad for you, the worse the pain system gets dialed up. Also, the research shows if you become overprotective and you try to avoid anything that gives any sensation in that area, it can dial the pain system up. So it's important to not try and avoid all discomfort or all sensations you feel there. And it's important to, if you feel something then you're really worried about your injury, just pause for a moment and ask yourself what it is that you feel. Because I've seen it, especially with back pain patients as well. When we first start movement, they'll go, no, 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 that hurts. And then I'll challenge them and just say, does it hurt? Or do you just feel something there? And often the answer is, I just feel something there. And then they can actually go on and it's absolutely fine. So for tendons specifically, the level of discomfort that's been shown that's okay is if you don't feel more than what we call a niggle level of discomfort while you're doing an activity. So that's a 1 or 2 out of 10 discomfort if you want a numeric number. It's not something you would class as pain, and it's something that if you do it at that level, you remain pretty comfortable when you stop the activity, and you don't have to actually now adapt everything else you do in that day or the next day because everything is now flared up. And that's the second thing. It's got to be at that low level while you're doing whatever you're doing, but then in the 24 hours afterwards, especially the next day. And for gluteal tendinopathy, what happens in bed that evening can often be um, tell you whether it's been too much or not. That should stay kind of at the same level of discomfort you normally feel. So the two things you're looking at is what am I feeling while I'm doing the exercises? And then also how does this pain or discomfort react in the 24 hours afterwards? If it increases by a little bit and it calms back down quite quickly within that 24 hours or a few hours later, it's absolutely fine to continue. But if you're starting to see a trend over time that it flares up worse for the same type of exercise, it takes longer to recover from a bout of exercise. Or if you look at what you were able to do this week versus what you could do last week, and it's actually on a downward curve function-wise, that can all be a sign that you're doing too much. And it doesn't have to be just the rehab exercises. It can be everything you do in the day. Because whenever we're upright, your glute tendons have to work. So standing, walking, jumping, running, all of those things work the glutes. And it's the total load on the glute tendons throughout the week that accumulates and that counts towards how much they can handle. So yes, it's useful to look at one rehab session at a time, but it's also important to look at everything you did in that day, if you get a flare up, especially, plus what did you do the days before. And keep in mind that often the discomfort I wake up with today or that I had during the night is likely down to something I did the previous day.